Is Zimbabwe prepared or not? That has been the question ever since the novel coronavirus, which is responsible for causing COVID-19, hit China in December last year, before it caused havoc in the health sectors of countries like Italy, the United States, the United Kingdom, and others. The debate heightened when our neighbor South Africa had its first case. That is when it dawned to many that it was a question of when and not if. Zimbabwe geared up preparations and declared Wilkins Hospital and Thorngrove in Bulawayo as treatment centers.
There are a lot of gaps in terms of our health sector and the way that they have responded actually to this global pandemic. You know, right now we only have Wilkins Hospital, which is only one quarantine facility in the country. Also, we do not have proper adequate ICU beds at Wilkins. You know, with serious infections, what we have noticed in China is that they have to undergo assisted breathing with ventilators. We do not have those inadequate at Wilkins. Also, even the protective gear for the health workers themselves, they are actually being placed under a health hazard if they are to face a patient with suspected COVID-19 infection.
After the first COVID-19 related death, the government assured citizens that there was no need to panic.
And I wish to advise our nation not to panic because of this death. As COVID-19 is treatable if someone has all the precautionary measures in place. The government of Zimbabwe, as declared by His Excellency, the President of the Republic of Zimbabwe, is in the process of mobilizing all the resources available to it in order to mount a sustained response to the COVID-19 pandemic.
Since then, a number of donations have been made to ensure that the situation in the COVID-19 treatment centers improve. The global death toll is rising, and this makes a lot of citizens uneasy.
We can all see we are least prepared. Taking lessons from what other countries have gone through, what is happening now, from the 3 official confirmed cases that we have so far. I think if you properly look at the cases and how the people entered into the country, how they got infected and so forth, there is clear evidence that we are not thoroughly prepared to deal with the pandemic. Unfortunately, one of the cases became critical and we lost a life. But that particular case is something for us to learn from. That person went through the airport, were there screening machines, testing kids to tell whether somebody is infected or not. So that is one case that has been, identified. How many people are going through the borders without being properly tested.
Launching the preparedness program, President Emmerson Mnangagwa said his administration was stepping up efforts to combat the spread of the virus in Zimbabwe and asked for cooperation and patience from citizens, given the fragility of the situation on the ground.
With our HIV prevalence of 40% in Zimbabwe, or slightly below, and malnutrition, and other non-communicable diseases, especially among children, we are deeply concerned about the impact COVID-19 could have in Zimbabwe. This situation is a real threat to all the citizens of our mother country. My government is very much committed to stopping COVID-19 right in its tracks, following declaration of this outbreak as a public health emergency of international concern by the World Organization earlier this year. So my government, through the Ministry of Health and Child Care, has put in place and continues to enhance measures to minimize the import of COVID-19 into the country and ensure health safety for all citizens of our country. The National Emergency Preparedness and Response Mechanism for surveillance and early detection of any possible cases was activated, and they will remain active until after the World Organization has removed the global health alert. Our preparedness measures have been stepped up through heightened surveillance systems at national, provincial, and district level, with a special focus on all ports of entry throughout the country.